Madam Chair, members of the board, and Madam Superintendent, as you are aware, COVID vaccinations are rolling out across the country. Thanks to the Department of Health, there are several of our employees who had access to their first dose of the vaccine as well as their second. A matter of fact, here are two of our employees that qualified for Phase 1A Plus through our partnership with DPH and were able to receive the vaccinations at the Atlanta Motor Speedway. Because of your commitment to leading the way in our community, we are furthering our proactive mitigation strategies to help stop the spread in Henry County schools and the community. Henry County's vaccination strategy team has not skipped a beat since our last meeting in its development of a vaccination plan. At the last board meeting, I shared there are 4 phases in Georgia's plan that are prioritized based on the most critical workforce and those more susceptible to exposure being included in the first phase as outlined. Our focus is not on when the vaccine will be available. We are just thankful that the educators were placed in a high priority status under the direction of our governor. To that end, our focus is on making certain we are fully prepared so when the shift is to Phase 1B occurs, we will be able to implement our detailed plan. Board, we know you believe that employee wellness is key to our staff being confident in delivering an exceptional learning experience for our students. We also know that you believe that planning involves effective systems and processes. So today, we're sharing the Henry County Schools Vaccination Strategy Plan. This report will highlight the structures and systems that have been put in place by our vaccination strategy team. We are working while realizing that a decision to participate in the COVID-19 vaccination program is indeed a personal one. And we respect everyone's right to make their own healthcare decisions, but we also believe that preparation for and access to vaccine are tools that will ensure and improve the well-being of our dedicated teachers while they educate, support, and mentor our students in Henry County schools. Board, I will turn it over to 2 of our vaccination strategy team members, Nicole McDowell and Kimberly Jackson. Nicole McDowell is our lead, and they will report to you on our Henry County School vaccination plan. Nicole McDowell will provide information on 3 scenarios associated with the distribution of the COVID vaccine. You will hear the term pod throughout the presentation. In Scenario 1, we will hear about a closed point of distribution plan, which is referred to in the presentation as a closed pod. Closed point of distribution site, also referred to as a closed pod, is a location that is operated by a private organization for a specific target group and their families and clients. Closed pod sites are not open to the public. It allows Henry County Schools to receive and administer the vaccine to its employees. The scenarios for the report from the team are Scenario 1, an internal closed pod, which is where Henry County schools trained staff will receive and administer the vaccine to its employees. Scenario 2 is an external closed pod where Henry County Schools will partner with an external provider who will receive the vaccine on behalf of Henry County Schools and will use their staff and systems to run the vaccination administration process. And then Scenario 3, which is an open point of distribution. An open point of distribution site, or an open pod, is where a local public health department that is open to everyone who lives or works in that community. Open pod sites are meant to serve the entire public. In this case, we will partner with an external provider of the vaccine to support servicing the vaccination needs of our employees to the extent possible. The difference between a closed pod and an open pod is the closed pod is exclusive to Henry County Schools employees. An open pod is open to the entire Henry County community. You're about to hear the vaccination strategy prepared for and presented to the Department of Public Health in our Henry County School Vaccination Strategy Team Medical Advisory. We are so thankful that they are contributing their guidance to our planning process. I would like to take a moment to have our vaccination strategy team, because it was a team effort across cross-divisional partners. Would you please stand at this time and be recognized for your hard work? I can't wait for you to hear how much work they put into this plan. So at this time, I will now turn it over to Nicole McDowell and Kimberly Jackson.
Good afternoon, Madam Chair, members of the board, and Superintendent Davis. On January 8th, Henry County Schools submitted an application to the Department of Public Health to be approved as a closed pod for the administration of the COVID-19 vaccination. A strategy team was assigned to create a plan, provide oversight for the implementation of the plan after approval from the Department of Public Health. The details of each scenario includes authorized staff, a vaccination self-education plan to ensure all Henry County Schools employees are provided with the most recent educational materials to make an informed personal decision prior to receiving the vaccination. A personal decision-making and commitment survey will be shared in an electronic version and a hard copy for any of our staff that do not have access to technology. The survey will include will provide for us the number of staff that have interest in the survey, and will also give us the information we will need to order the number of vaccinations. The plan also includes inventory and scheduling and involves securing a vaccination site. For scenarios 1 and 2, that vaccination site will be Henry County Learning and Support Center. The plan includes storage of a vaccination. That includes daily monitoring of a refrigeration system, scheduling and monitoring of appointments, and data reporting into the Georgia Registry of Immunization, Transaction, and Services, known as GRITS. Scenario 1, as indicated by Dr. Madden, an internal closed pod, is managed and operated solely by Henry County Schools employees. An internal closed pod involves Henry County Schools nurses administering the vaccination to our Henry County Schools employees. The entire oversight and management and execution of the plan will be done by Henry County Schools employees. The extent of a partnership in an internal closed pod goes to the point of assigning a medical director, and that's the extent of our partnership for Scenario 1. At this time, I'll turn it over to my colleague, Kim Jackson, who will give insight to our project management tool and also share with you considerations for each one of the scenarios.
Good afternoon, Madam Chair, members of the board, and Madam Superintendent. I am pleased to have the opportunity to give you a closer look at our detailed project proposals that we have developed to ensure that we can effectively execute one or more of our Plan 3 scenarios. To orient you to our planning document, each of our scenarios will take into account 4 major areas of consideration, or what we like to call our big rocks. They are state approval and external partnerships, staffing, communication, promotion, education, and finally, logistics, clinic flow, and supplies. As a refresher, Scenario 1, Henry County Schools would be fully responsible for hosting the vaccine clinic at the Henry County Learning and Support Center, and our nurses would administer the vaccines to our employees and contracted staff. Let's begin by taking a look at the considerations or big rocks for Scenario 1. As you can see, under state and external partnerships, we submitted an application to be a closed pod provider on January 8th. And last Thursday, we had the opportunity and privilege to present our plans to the Department of Public Health, DPH. Upon approval of our application, we will need to secure a memorandum of understanding with a person who could serve as our medical director. In addition, we are researching private school partnerships so that we can assist other local educational entities with receiving the vaccine through our internal closed pod. Next, we mapped out the staffing needs to support Scenario 1. First, we determined that we needed to designate staff to serve in leadership roles to support our proposed on-site vaccine clinic and designate a staff member to act as the external partner liaison. Naturally, we will need clinical staff to run an on-site internal closed pod. Last week, we met with and surveyed our Henry County Schools nurses to gauge their willingness and comfort level with administering the vaccine and entering immunization records into the state portal called GRITS. We are fortunate that nearly all of our nurses are eager to assist with the vaccination effort. In the coming weeks, we will begin to educate and train our nursing staff on what they need to know about the Moderna vaccine and how to properly administer it. Since this is an on-site clinic, we will also need the support of the emergency management technician, the EMT services as well. We also considered other staffing needs like Henry County attendants for check-in, security for crowd and traffic control, custodial staff, and on-site technology assistance. One of the most important components of our planning is the communications plan, and it applies to all three scenarios. We want to ensure that our employees and contracted staff understand the importance and safety of the COVID-19 vaccine. We plan to provide resources so that our employees can self-educate themselves about COVID and the efficacy and safety of the vaccine. We also plan to survey our employees to determine their desire to be immunized against the COVID virus. Our communications division has developed a more extensive communication plan that sits behind our project document. This is a quick glimpse into our communications department's week-by-week plan to ensure that we are educating our employee population about the importance of taking the vaccine, where we are in the approval process, self-education resources, and scheduling. The last major consideration for Scenario 1 is logistics, clinic flow, and supplies. Under facilities, if we are planning to operate an on-site clinic ourselves, we have to make sure that we have the correct refrigeration and backup generators available on-site in order to properly store and maintain the vaccine. Next, vaccine administration and inventory are those things that we need to consider and develop plans around how we will provide things like personal protection equipment, PPE, for our staff, preserve vaccination records, and enter immunization data into the state immunization database, GRITS. Next, we focused on scheduling and data management because we must have a way to efficiently schedule appointments for employees to take the vaccine and set up second dose appointments. Finally, we listed out our supply needs. Now I will turn it back over to Nicole.
As a part of our logistics and clinic flow, we created a plan for a curbside layout and a contingency plan for indoor layout in the event we experience inclement weather. Our curbside layout has a total of 5 stations. We would have 2 entrance lanes, a check-in registration lanes, the actual vaccination lane where staff members will receive the vaccine, a post-observation parking lot that will be separated into 2 areas. One area will be for 15 minutes, the other area will be for 30 minutes, in the event we have staff that may have an adverse reaction to the COVID vaccination. And then the last section would be for our employees to exit. In the event we experience inclement weather, we would again have the check-in and registration area, clinic entrance, vaccination waiting area, the area where staff will receive the vaccination, post-observation again broken into 2 areas, and the exit. We've also included a detailed layout of the floor plan in the event we have to bring the vaccination administration indoors. And as with all plans, you can anticipate barriers, and of course, we have needs. As you can see, some of our needs, or as we go through the presentation, some of our needs are consistent, which has been consistent across the country with vaccination availability, need for an external partner to act as a medical director for Scenario 1. We have 13 nursing staff and over 6,000 employees, so I'm sure you can imagine the task that would take for all of our nurses to administer that number of vaccinations. At this time, we do not have a scheduling platform. However, we've partnered with technology, and they've been very supportive in identifying various scheduling platforms that we can look into purchasing. But in purchasing a platform, of course, funding would be required. Our needs and our barriers are duplicate in both areas. Our next scenario, Scenario 2, external administration of a closed pod. External closed pod is managed by the external partner. The external partner provides the staffing, has oversight of the inventory, and scheduling the appointments. The vaccine administration, they oversee tracking and monitoring of the number of vaccines issued, and they are also responsible for compiling vaccination participation and entering the data into the grid system. Again, the various categories are the same throughout Scenario 1, 2, and 3. The authorized staffing, vaccine self-education, the personal decision-making and commitment survey that I spoke of earlier, identifying the facility, and for Scenario 2, again, that would be Henry County Learning and Support Center, the inventory and scheduling, vaccine administration, and the data sharing. We've had extensive conversation with a number of external partners. CVS, we've had conversations with CORE, Community Organized Relief Effort, SAMS, an extensive conversation with Moy's Pharmacy, which is a local pharmacy here in Henry County. Moy's Pharmacy provided us their plan if we were to partner, and CVS did as well. And at this time, I will turn it back over to my colleague again, who will share more insight on our data management tool.
Okay, Scenario 2 involves contracting with an external partner who would run a vaccine clinic on our site at the Henry County Learning and Support Center, and they would administer the vaccine for us. For this particular scenario, number 2, we would need to secure an MOU with an external partner to run our on-site clinic, and we would continue to research how we could partner with a local private schools to assist them with receiving the vaccine through this external closed pod model. Like Scenario 1, we determined that we needed to designate staff to serve in leadership roles to support our proposed on-site vaccine clinic to coordinate with the external provider who will actually administer the vaccines. Unlike the previous scenario, we will not need clinical staff. However, we would still need the assistance of on-site EMT services. Again, like the previous scenario, we also considered the needs for Henry County staff, like attendance, security, custodial staff, and on-site technology support. Our communication, promotion, and education considerations are the same as in the previous scenario. We want to ensure that our employees and contracted staff understand the importance and safety of the COVID-19 vaccine so that they will make informed personal decisions about being immunized against the COVID-19 virus. Like the previous scenarios, we will continue to survey our employees to determine their interest in receiving the vaccine. The last major consideration for Scenario 2, again, is the logistics. So under facilities, if we are planning to operate an on-site clinic with an external partner, we will still need to provide refrigeration storage and backup generators. Under vaccine administration and inventory category, we will need to provide PPE or personal protective equipment for our on-site staff. However, the scheduling and vaccine administration would be handled by the external partner, and we would need limited supplies. Now I'm going to turn it back over to Nicole.
And again, like I stated before, there are barriers and needs to all three scenarios: vaccine availability. In scenario 2, with an external partner, we would have less control over the scheduling and clinic setup. So in the event one of our staff would have an issue with technology, we would have to send them to our external partner to work out any logistics problems they may have. A cost associated with external provider for on-site clinic setup, staffing, and administration charges. We had an extensive conversation with one external partner. In the initial conversation, they gave us a quote for the administration price. And then our second conversation, much to our surprise, the price doubled. The timing and readiness of an external provider due to the competition in staffing, potential limits to the clinic setup. And what we mean by that is, again, one conversation we had with an external partner, we feel that it would be best to do a curbside layout. As you know, as you're administering vaccinations, there's constant sanitation and cleaning and wiping. So to keep a flow and keep things moving in a timely manner, we would like to do the curbside setup. That's a setup that they were opposed to and said that they would only do an indoor administration. And again, the funding that's consistent through all three scenarios. And our last scenario is scenario 3, which is an open pod. And an open pod distribution site would be located off-site. It's operated by a local public health department that is open to everyone who lives and works in Henry County. An example of an open pod is where our nurses, our OT staff, and our other staff received their vaccination just recently. Again, the categories that we've identified for an open pod is consistent with scenario 1 and scenario 2. I won't take time to go over it again. I'm sure you all are well versed in it now. And at this time, what I will do is turn this over to my colleague again, to Ms. Jackson, and she'll share more information about our project management tool.
Okay, moving to our last scenario where the clinic would be hosted off-site by an external partner, we would need to still secure an MOU with an external partner to provide vaccination services off-site and to ensure an appropriate amount of vaccines are set aside for our employees and contracted staff. We would continue to research how we could collaborate with local private schools to assist them in receiving the vaccine through our external open pod. And the communications plan, as you can see, will remain the same. We would not need staffing because the clinic would be, again, off-site and administered by an external partner, nor would we need to consider any of the logistical matters like the facility, refrigeration, and scheduling. Now I would like to turn this presentation back over to Dr. Madden.
Board, as you have seen and heard, extensive planning has gone into the development of our vaccination strategy plan. There are 3 scenarios that were shared with you today. I would like to reiterate that both parties, the Department of Public Health and our medical advisory team, which was composed of a chief officer at a hospital, we have a CDC scientist, we have a pharmacist, and we have a local physician on that advisory team. We are hopeful because they were equally impressed with the detail that was outlined in this plan. So we are hopeful about being approved as an internal closed pod of distribution site and eagerly await to continue to support our community in its mitigation efforts for COVID. So I wanted to say, I want this team to stand up one last time because I told you ahead of what you saw how much work was entailed, but let's let them stand up one more time so that you can see the hard work of this team every morning, 8 o'clock, and throughout the day. Madam Superintendent, that concludes what I have prepared for you today. I turn it back over to you.
Thank you, Dr. Madden. Madam Chair, that concludes what we have prepared, but remain available for any discussion. Thank you, Dr. Davis, and thank you, Dr. Madden, for that wonderful presentation. Does any board member have any questions or comments at this time? Mr. McDaniel?
Thank you, Dr. Madden, and your team for the work that you all did, the awesome work that you all did. If I can remember what Miss Macon G would say in Chamblee Charter High School, she said, kudos and mazel tovs. This is extraordinary. All the hard work that you all did to allow our school system to take care of its own. That speaks volumes to your dedication, your tenacity, your vision of how we take care of our own. And I can't say thank you enough. So it is my hope that everything goes well. I think that one of these three scenarios, one's got to be best than the other two. But again, thank you so much for what you're doing, and continue the good work. And thank you for looking out for your fellow colleagues. Thank you so much.
Thank you. Thank you, Mr. McDaniel. Mrs. Pope?
Yes, thank you. I am really speechless. Dr. Madden and Ms. McDowell and Ms. Jackson, y'all did a phenomenal job presenting that information. I know there are so many more that have been working alongside y'all. But, I mean, this is just truly amazing. I really am at a loss for words. It really is like, this is compassion, and this is how we can be a compassionate employer and take care, like Mr. McDaniel said, take care of our employees. But, I mean, this is the most detailed and sophisticated and well thought out plan that I have seen. And I am looking forward to y'all's presentation to the state and to the nation on how this can be duplicated. But all of this is happening while kids are still learning. So I'm really grateful, and I hope that this is a reflection of all of our desire to be a good employer also. Thank you so much.
Thank you, Mrs. Pope. Dr. Nutt?
I have one question. Dr. Davis, can you speak to, she mentioned several times about the refrigeration and that process of keeping the medicine. Can you talk to that? What do we have to do anything special?
Thank you for that question. I mean, really, we talk about refrigeration and cooler systems for our food nutrition program, but this is definitely a new way to talk about that responsibility. If it's okay, I'd like to ask Mr. Malcolm. He has been our member of the team who's handled all the operations in coordination with the State Department of Public Health. So turn to you, Mr. Malcolm, for refrigeration assessment.
Great question. That cooler freezer at the Learning and Support Center was actually replaced as part of Group 1 renovation, so in 2014. So it's fairly new out there. And in working with April and her team, finding out what they needed, our current freezer will get to -20, which is good for the initial storage of the vaccine. From there, we've been told that the cooler needs to be between 36 and 46 degrees. Currently, it is at 34, but we're working to it's easier to bump it up than bump it down. So we feel very confident that we can get to the temperatures needed for that. In addition, there currently is not a generator out there, but we've already looked into getting generators for both the cooler and the freezer at the Learning and Support Center. And along with that, we do have energy management at that site, so we will be able to track temperatures all day long. So we'll know, and we have low temperature alarms on that energy management system that will alert facilities and maintenance if we start to have an issue with that. But even if we did, we'll have the backup of the generator system. And we're going to move some of our staff over there during this time to be on site at all times for monitoring of that system. So have worked a lot with Dr. Madden and her team to bring us up to speed on what they need over there, and we feel very confident that the refrigeration that we have available will work for this initiative.
Thank you.
Thank you, Dr. Nutt. Dr. Davis, did you have something further to share?
Yes, Madam Chair, I would like to add, first of all, the individuals that are sitting in these seats as part of our vaccination strategy team have 110% larger portfolios that never had vaccine strategy on it before. The way they have elevated this responsibility to the absolute top priority is commendable. It's really astonishing. I don't know where we're getting the hours in our 24-hour period, and I know you don't know that either. But there's a couple things I want to mention that this phenomenal presentation team did not include. First of all, this was the actual presentation to the Department of Public Health. And so while it may have seemed like a level of complexity uncommon for a board presentation, we felt that our public should hear exactly what was presented to our Department of Public Health officials. And I also believe that this team failed to tell you the reaction it actually got. I believe the words were, "You have blown our socks off." The Department of Public Health officials deem this the best plan that they have seen. They did see this as a replicable and possible statewide model. And right now, I think it's helpful for our community to know right where we are. First of all, we know that the vaccine is a personal choice, and we want self-education to be in the hands of our employees to begin to consider what is the right decision for their family. That self-education should begin this week. We do also need to move toward a survey of interest so that we can begin to apply for the number of doses that our community of schools may require. And we are this week awaiting approval as a closed pod internal administration site. That is a big deal, and I really do feel like there isn't any other details that could have been considered in order to get us to this point this quickly. So, a couple of questions I get often. I get asked, can we have multiple locations so that the proximity to one's work site might be more conveniently located? And at this time, the sophistication and attention given to the quality of the site is pretty significant. We will be visited by the Department of Public Health state officials. It will be examined, assessed. Like mentioned, all of our environmental conditions will need to be monitored and reported on a regular basis. And so at this time, our capacity as an organization is probably a one-site solution until that evolves over time. But right now, we're looking at a one-site solution. The second I get a lot is, will this be required as an employee of Henry County Schools? And I want to make sure we're clear that this is not required. We do see the advantages for our community health. It's why we've reached out to partner with our private schools. It's our moral opportunity to be a part of health and well-being for our entire community. And I believe we have a lot of testimonials to talk to the safety and the good experience that our own employees have had, as well as our partners in the medical community. But it is not required. However, we are eager to be able to create access for our employees because we know many are eager as well. And then finally, I just want to close by saying that we are approaching March. We are approaching 1 year from when we said we were going to be closed for 2 weeks. For 2 weeks. But in that time period, not only have our educators upended public education, but our professionals have expanded their work responsibilities with a level of confidence that should be encouraging to our entire community. And I just want to just take this moment and say none of that is possible without a unified governance team who sits at the helm of this work that we do as an organization and who has been in front of this work leading public education while managing a public health crisis. So I want to applaud our Board of Education and thank you for the space you have given to do the most extraordinary body of work that this season has called upon us to do. And so, Madam Chair, that concludes what I have prepared, and I'll turn it back over to you for any other discussion.
Thank you, Dr. Davis, and thank you so much, Dr. Madden. That was just completely impressive, and I just want to thank you and your team for all of that hard work, and looking forward to us being approved for that because it's just remarkable. So thank you so much.